and yet still people continue to depend more or less on traditional birth attendants.
The maternal health augmentation program will additionally provide assistance and requisite medical paraphernalia for health facilities in the region. Second-level clinics in the area would also benefit from aid and technical guidance, which shall include monthly postnatal health checks. It's a critical step questing to improve maternal health, giving optimum care to women during pregnancy, childbirth, and the ensuing stages of motherhood. Building the capacities of nurses and midwives to lessen and alleviate morbidity and maternal mortality is at the top of priorities in the health sector as government moves to achieve one of the greatest objectives of the Millennium Development Goals targeted for attainment by 2015. Ibrahim Ajata.
Members of the Armed and Security Services, the Gambia Legion and voluntary organizations Sunday morning conducted a parade in observance of World Remembrance Day, celebrated every second Sunday of November. Samuel Ba witnessed the colorful march past at the July 22nd Square in Banjul and reports that the event is meant to recognize and appreciate the ultimate sacrifice of the war's veterans of the war veterans of both wars and other military campaigns.
Remembrance Day is observed on the second Sunday of November, generally the second Sunday nearest to the 11th of November. The day is set aside to remember and appreciate all those men and women who bet their lives during the First and Second World Wars for the cause of humanity. The wars may have long gone, but their impact brought a great deal of disruption and challenges in many parts of Africa. It is the Gambia Armed Forces once again celebrating Remembrance Day, a day characterized by special activities at war memorials, paying homage to gallant war veterans. A solemn and elaborate processional parade demonstrating undying solidarity for the veterans and lost ones before their friends and families. The national flag was diligently laid on the piled drums with accuracy and great ceremony, sounding the reveille, which marked the end of a few minutes of silence recalling the heroic deeds of volunteers who fought to restore peace in the world. That activity was soon followed by the laying of fresh wreaths beside the war memorials. The chief guest of honor then meets and shakes hands with war veterans before the surrendering of colored flags, given effect by a poignant march-out parade. The Gambia's involvement in the two wars was eminent, following Britain's heavy bombardment by Germany. The colonial masters had to look for reinforcement from its colonies. About 4,000 Gambians were said to have been conscripted to fight for the British Empire, with the biggest British Royal Navy base hosted in Bathurst. These surviving Gambian war veterans represent thousands of heroic men and women who stood up against tyranny for the emancipation of the human race. Their story is one of bravery and great sacrifice to make the world a better place for all. Samuel Ba, GRTS.
The quest to uplift the quality of health delivery has impelled the Minister of Health and Social Welfare, Fatim Baji, and a diverse team of officials to travel across the country, visiting hospitals, clinics, and medical facilities to scrutinize the services they provide. Ibrahim Ajada reports that the pursuit to meet the global MDGs has never been so intense.
It's an extensive tour, taking the Minister of Health and a diverse delegation of health officials to all medical facilities across the country. A significant move to augment the national health delivery system. Officials are scrutinizing everything, from hospitals to the services they provide, the available medical resources, and the list of inadequacies hampering the delivery of health services in the country.
this is always part of our responsibility to do a tour, a nationwide tour, quarterly by the senior management, and of course at least twice a year by the Minister of Health and the entire team to follow up and check on the facilities. For us, this is a way of relating back to those who are working our facilities, sharing our policies and sharing our strategies.
Officials crisscross the whole country, inspecting hospitals, clinics, and medical facilities from the city to the last settlement in the Gambia, critically appraising the impact of health programs and the hitches affecting service delivery.
And we don't want our hospitals full, we want it to be empty. So really we have to ensure that by the time we have our patients, we take care of them in a way that they're not only leaving treated, but they're leaving educated.
The tour commenced in Banjul, where officials visited the Pakala Clinic and Lehman Street Health Center, making emphasis on the essence of dependable data to guide the development of health programs and interventions before proceeding to the expansive West Coast region, which has 2 regional health teams in Kanifing and Brikama overseeing the most populous part of the Gambia. Day 2 of the nationwide exploration of health facilities saw officials touring a host of clinics in the North Bank region, where the Minister of Health held meetings with the area's health teams, outlining the strengths and shortfalls influencing the delivery of health programs in the region. A drive to secure first-hand data and information, officials are essentially examining figures on communicable and non-communicable diseases, as well as the range of medical complications being dealt with across the country. An increasing prevalence of malaria, which tends to swell maternal and child deaths, has been noted, prompting officials to rouse the National Malaria Control Program and regional health teams to urgent action towards allaying the flow of the disease seemingly in its high season around the country.
I think people should really use the bread nets. It's very important. It can really help save lives, and school is on right now. Children need to be at school, people need to work. And really respect has to be given to the mosquito. And that is that the mosquito can kill. As little as it is. It's not a matter of hitting it off, but it can kill. They need to not underestimate the mosquito. Sleep on the nets and spray constantly and use preventive measures and treatment.
Another critical problem under scrutiny is the issue of maternal deaths, which have really seen a significant drop in certain sections, such as the North Bank region, where an exemplary clinic in Badibu, Jabakunda, is taking the delivery of health services to whole new spectrums with great results. A novel scheme being driven by the Health Ministry also seeks to extend the registering of all deaths anywhere they occur, mobilizing community support to certify every death, which takes place the same way newborns are registered across the country.
So I think birth and death registration is very important. And the registration of birth and death, what we are trying to do at the moment is involve the imams and the alcalos. We have come to identify that for every birth ceremony or naming ceremony and every death or burial, an imam is always present, or a pastor or a priest.
It's a mandate of the Honorable Minister to come 1 or twice a year to see what is going on, to have a first-hand information on both government and public facilities.
A hugely decentralized health system leaves regional health teams chiefly responsible for their assigned communities. Broadening this role, officials want health teams and their regions to take unreserved ownership of medical facilities and programs, making honest decisions to advance the delivery of services.
These are people who make sure that the health facilities, the health service delivery in the region is well applied.
Following an uneven course, which took them to 7 regional health teams and a range of hospitals and medical centers, from Banjul to Koina, the drive to augment the national health service delivery system has never been so intense. Ibrahima Jata, GRTS.
We'll now take our first break. Now the news continues momentarily.
To win fabulous prizes, but you win only if you answer questions we ask you correctly. To be part of the show, you should know the numbers by now. Type BUDDIES buddies to your favorite network: AfriCell 2020 200, QCell 3030 300, Chromium 60 60 600, and Gamcell on 999 0909, and we will call you back. Make sure you have 4 friends ready to participate. Talk to you soon.
Welcome back. The Israeli Prime Minister Benjamin Netanyahu has warned of a major escalation if Hamas and its affiliates continue to fire rockets into Israel. The warning comes as